Goals. The patient exhibit a tracheostomy tube and sit free from drainage, secretion, and skin irritation or breakdown. Next is the equipment. The equipment needed. Check for bedside table, towel, tracheostomy, suction supplies, sterile tracheostomy care kit if available. Be sure to collect the supplies listed that are not available in kit, or 2 sterile 4x4-inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing, pre-cut and sewed surgical dressing, sterile basin, small sterile brush, pipe cleaner or disposable inner cannula. Next is small brush, roll of twill tape, tracheostomy ties or tracheostomy holder scissors, and pulse oximeter, stethoscope, clean gloves, 2 pairs, mask gloves or face shield, hydrogen peroxide, and plain PNSS or sterile water. For implementation, 1. Bring necessary equipment to the bedside stand or the overbed table. 2. Perform hand hygiene and put on PPE if indicated. 3. Identify the client or the patient. Next is 4. Close the curtain around the bed and close the door to the room if possible. Determine the need for the tracheostomy care, and explain what are you going to do and the reason to the patient, even if the patient does not appear to be alert. Next is adjust bed to comfortable working position, usually below the height of the caregiver. Lower the side rails and closest to you. If the patient is conscious, place him or her in semi-fowler's position. If the patient is unconscious, place him or her in the lateral position facing you. Move the overbed table close to the work area and raise the waist height. 8. Check for the lung sounds. Next is place the towel below the trachea site, covering the neck and the chest of the patient or the client. 10. Put on the shield or goggles and mask. Suction tracheostomy if necessary. If tracheostomy has just been suctioned, remove the solid side dressing and discard before removal of the gloves used to perform suctioning. Next, prepare the basin and the cleaning solution. Mix sterile water and PNSS and H2O2 in one basin. Be sure it will fill the 0.5 inch of the basin. Add another another basin that will at least half inch. 12. Perform hand gloving and cleaning the tracheostomy tube. Remove the oxygen source in present. Establish the outer cannula and the placement of the tracheostomy with the non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release the lock. Gently remove your inner cannula and place it with the first basin in PNSS plus H2O2. Let submerge there for a few minutes. Next is stimulus. Gently slide the trachea pad dressing downward and discard. Check for some exudate or drainage, skin breakdown, irritation, and inflammation. Clean the inner cannula for the trachea tube using the prepared PNSS plus H2O2 and use brush to remove the solidified or sticky mucus. Rinse using the second basin with PNSS only, and discard the glove and put on another glove if necessary. Dry the inner cannula using a sterile glass pod. Gently reinsert it back to the tracheostomy tube. Be sure it's properly locked. Dip cotton tip applicator or gauze sponge in cup of basin with a sterile saline and clean stomach under the face plate. Use each applicator or sponge only once removing stomach side outward from stomach side outward. Next is pat skin gently with dry 4x4 gauze sponge. Next is slide commercially prepared tracheostomy dressing or prefold non-cotton filled 4x4-inch dressing under the face pole. Check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Reapply oxygen source if necessary. Remove the gloves. Assist the patient to the comfortable position. Raise the side rails or the bed rails and place the bed in the lowest position. And remove the additional protective personal equipment if used. Perform hand hygiene and documentation. Reassess the patient respiratory status, including respiratory rate, effort, oxygen saturation, and lungs.